It's now my true pleasure to introduce our keynote speaker today. Dr. Consuelo Wilkins is a geriatrician and clinical investigator. She also serves as the Vice President for Health Equity here at VUMC. She leads the Office of Health Equity in connecting our existing health equity initiatives while still developing system-wide efforts to address disparities in health. Dr. Wilkins is a professor of medicine here in the School of Medicine and is the principal investigator on 3 NIH-funded centers. She also continues to serve as the executive director of the Meharry-Vanderbilt Alliance. Please join me in welcoming Dr. Wilkins to the stage.
I wasn't doing that for applause. Vanderbilt University Medical Center is a global leader in personalized medicine. We provide world-class care to patients and families in the region and around the country. We're responsible for some of the most important discoveries and making sure that those discoveries get implemented into practice. We also produce some of the most important and influential healthcare leaders. There's plenty of evidence that Vanderbilt is an important, if not integral, organization for healthcare. We're consistently ranked by the U.S. News and World Reports, as well as other organizations, for our quality of care, the resources we provide. We're best in Nashville, which is the epicenter of healthcare. We have evidence that Vanderbilt is incredible at the institutional level with these awards and recognition for patient experience, but also at the individual level with some of the most incredible and amazing people that we have the opportunity to work with. In the fields of research, education, biomedical informatics, nursing. But at the heart of what we do, at the heart of why we're so important, is our caring spirit. When we think about the caring spirit of Vanderbilt's people, we automatically think about the people we see every day, those who are touching the lives of patients. We think about how we save lives, how we increase life expectancy, how we're able to bring cures to patients in the community faster. That caring spirit is represented by more than 25,000 people and their families. So when I was asked to talk about the caring spirit of our people, it seemed easy. So I have the fortune, or occasionally not so fortunate, opportunity to live with teenagers. I have a 13-year-old and a 16-year-old. And so that's really, having live-in, unfiltered feedback, sometimes solicited, sometimes not, right? So as I'm thinking about what I'm going to talk about, I go to my 16-year-old, and her brother is not too far away from her on his digital device on his iPhone. And I say, what do you think of this? It's an image, it's a graphic of people in the clinical setting. Those are sort of the looks I get. And she goes, what's it for? What are you talking about? They're used to seeing me sort of preparing slides and presentations. What are you talking about? Well, I'm talking about the caring spirit of our people. What does that mean? How we care for people, how we're, isn't that what you're supposed to do? Meanwhile, my 13-year-old, who's sort of eavesdropping, is, looking, trying not to listen, trying not to pay attention, hoping I won't ask him any questions, of course. I go, what do you mean that's what we're supposed to do? He's like, isn't that what doctors and nurses do? Like, it's health care, right? Like, that's, like, I don't understand what you're talking about. So, of course, I found myself in a position that I have been in before with these, two amazing people that I get to live with, and that is being on the defensive. So now I'm sort of trying to explain to them why I have to talk about this and why it's important to say, and doctors and nurses, it's just not that. And so I realized, first, I probably need to make sure that they're around more nurses because they live with two physicians, and obviously we're not caring enough for them to convince them that this is important, right? But then the second thing I realized is that, okay, maybe I do need better examples. Maybe I do need to think about this differently. Maybe I need to think about how our people are caring outside of that patient interaction. So I started to think about all the different ways we as people at Vanderbilt University Medical Center care. And one of the first people who came to my mind is Daryl. Daryl is the lead environmental technician in our clinical research center, which is perhaps less than 100 yards here. I'm not that good with distance. There's not markers like on the football field, but not that far away from here. The reason I thought about Daryl is because the first time that I had an interaction with him, I was looking for the CRC before it was relocated, and it was hard to find in Medical Center North. Finding out which way is what comes after A, it's not necessarily B in Medical Center North. So I'm trying to get there, and I'm a little bit flustered, and so I run into this gentleman who's in the hallway, and he goes, "Can I help you find something?" Yeah. And so I tell him what I'm looking for, the conference room I try to get to, and he was sure to make sure I got there. He walked me to it and opened the door for me. I was incredibly grateful because, as I often do, I'm sort of pushing for time there, pushing the limits there. And so I realized at the time that I had a coat on and he couldn't see my name badge. And I'm conscious of that because as a physician, I realize the power I have and what that, emerald green or dark green band on my ID means. And so he didn't see it. He had no idea who I was. I had a coat on. And so I think that was important to me because I often think about how to make sure that everybody's voice is heard and that we are balancing power. And then I saw Daryl again recently. It was probably last year. And of course now we have our CRC, relatively new still, beautiful, off the circle here. And I was walking in. I knew where I was going this time. I knew how to get there. But there was a family that was standing there. It's nice, convenient to get out. They got out and didn't know where to go. Same, smiling, warm face, welcoming them into the building. He put them at ease. He made sure that they also got where they needed to go. And so I think that's the kind of caring spirit that I think about when we're talking about our people here. This is the finance team at our Vanderbilt Institute for Clinical and Translational Research. Now, I shouldn't say no offense because it sounds like it's offensive already, but for our finance and operations folks, not necessarily always thought of as the most caring people, right? At least not initially. When I think about the finance folks, especially those who I have to talk to about grants administration, I think, they're going to tell me I can't do this, I can't pay for that, the charges are wrong, you didn't add it right. I'm just thinking, I have to talk to the finance people. So Dr. Balzer mentioned that we have an important role in the nation's precision medicine initiative, the All of Us Research Program. In addition to being the data and research core, we're also the engagement core. We're responsible for getting input from participants to help guide the program. We're doing that for the country. We're one of the leaders in that space. And so as we're doing this, and you can see the picture of some of our participants there, we have to get people from around the country to meetings in Washington, D.C., where they're meeting with folks from the National Institutes of Health and other researchers so that they can actually be involved in the process. These are individuals from all walks of life, different health conditions, different backgrounds, and what it takes to actually get them from their homes. Some of them, as you can tell, are not ambulatory. They need to travel with companions. Some of them don't have checking accounts. So they've not stayed in hotels where you have to have a credit card and on file for incidentals. So I had to go and talk to Stacy West, who leads the team and is in the middle there. And I have to tell her that I need to be able to use these funds and get them out to these patients and participants in advance of the travel. I need to have approvals in place to make it easy for those who need companions to travel to get there. And Stacy and her team spent months working on this for us, writing policies, rewriting policies, writing interpretations of this to make sure that we could get this done. And I was so incredibly grateful for all the time that they spent doing this. And the final step, though, was that I had to talk to Cecilia Moore to get it approved. And the same care and consideration went into that decision making. I had a call with Cecilia when she was, I think, recovering from the flu or still had the flu. It was a brief call, but it was very much, why is this important? And what can't you do if this isn't done? And so now, this picture that you see here is with our participants from around the country in Washington, D.C., at the All of Us Research Program face-to-face meetings. So these are the kinds of things that happen within our institution. We also care beyond our walls, though. As part of our responsibility as a nonprofit healthcare institution, we have to do a community health needs assessment every 3 years. And now that we have a new partner, a new hospital in Wilson County, we have to do it in 2 years. That's part of the requirement. We do not take this lightly. We think it's very important for us to understand the needs of our patients and our communities. So I think we do probably one of the best jobs in the country with our community health needs assessment. Eliza Friedman, who's on my team, has been leading this for a number of years and has an incredible team. They've engaged almost 3,000 people across the area in listening direct input. What do you think? Surveys, interviews, listening sessions, and then we have these in-person meetings, these summits to actually prioritize them. It's quite a bit of work. And the most important piece of this, though, is that we have to develop plans for how we're going to address these needs. So I mentioned we're going to be adding Wilson County. Right now we focus on Davidson County, Williamson County, Rutherford County. You might be surprised how different, of course, these counties are. The top 4 priorities are the same, though. Mental health and substance abuse, access to the resources and services that they need to be healthy, social determinants of health. These are things that determine health outside of the clinical setting. Transportation, access to healthy foods, being able to live in an environment where you are socially connected. You also have ways to get from point A to B. You're in a community that's stable. Those are incredibly important things, as well as prevention and education. Now, suicide rates in Williamson County are some of the highest in the country. These are important issues that we have to tackle. We'll be moving forward with more intentional strategies in our VUMC-driven approach. So we'll be developing these health equity impact plans with many of you. And we'll also be supporting and collaborating with community organizations who are already doing some incredible work. Dr. Baldwin mentioned we're not providing housing. We're not doing some of those things that are still so important to being healthy. But many organizations are, and there are ways for us to partner and support them. Of course, we're already doing quite a bit of work in the community. So we want to expand our footprint, but we also need to make sure that we continue to support these programs that already exist. When we inventoried what we're doing a number of years ago, I think it was 3 or 4 years ago, more than 180 programs, activities focused on health equity and community health. One of them is the clinic at Mercury Courts. It's run by the School of Nursing. It's really an amazing place to go and see how much care is happening there. So at the clinic at Mercury Courts, which is on site at a residency community, a community where people who have low income, limited income reside. And truly the understanding and passion for people is evident across the team. If you run into Christian or Chad or others on the team at any point, you can tell how important this is and how much they love doing the work. For several years, we've also supported, through our partnership with Meharry and the Meharry-Vanderbilt Alliance, a faith and health collaborative. This program goes into the community, works with churches, at this point mostly African American and Hispanic or Latino churches, to think about and help shape, help support their programs that focus on health. One of the examples I'll provide is with Bishop Campbell of Mount Carmel Church. This is church here, up in the right-hand corner. Bishop Campbell has been developing programs to keep teens from getting into trouble. It's preventing violence. We offered, as part of our program, Health Equity Awards. These are small investments in programs that are already existing. Because of that, we think, and we certainly won't take credit for his incredible work, because of our involvement and being able to support him, not just with the dollars, but being able to support how they collect information and data. Bishop Campbell has received more than $40,000 in grants to continue to support his program, and additional publicity from that work. So these are important ways for us to have an impact in the community. So what happens if we all care? What happens when we care for each other? I talked about caring, how we care for others inside VUMC and beyond, but what about internally? This is sort of how many of our days and minutes feel. We're moving quickly. We barely notice each other. We're just trying to get the work done because we care. We care about the patients, the families, the communities. But sometimes we are not taking the time to care for each other. So when we look at these 7 levels of consciousness for leaders and how we balance the service and the focus on humanity to being financially stable enough to actually do the work. In the middle is this transformation space. And recognizing that this important balance is there as part of our responsibility. And how do we achieve it? With continuous learning and opportunities to support our teams. I spend a lot of time thinking about trust, and I'm trying to understand how to measure it and impact it. And I think one of the most important things, components of building trust, is assuming positive intent. Every day in this incredibly complex organization we have, there are opportunities for us to misunderstand or not have enough information, and sometimes that results in more confusion if we're not assuming positive intent. We didn't arrive at the table thinking about, maybe this person didn't know. Maybe they intended to do well. And that has got to be a different and more intentional focus for us. So how do we care for each other? We have to recognize leaders at every level. Daryl, who I had mentioned, I would say is a leader. He goes beyond his responsibility, his daily responsibility, to make sure that he is providing this safe space for people who look confused. How are we making sure that we're recognizing different ways among our teams, how they lead, how they step out and take the initiative? We have to do that. We also have to enable problem solving. Nancy Lorenzi gave me an example of how one of the employees took a very long time, many hours of the day, to solve a problem that a patient was having. Very intentional, focused so much on the patient and getting it resolved. This problem, though, was handed to the employee by another employee. And so my question to Nancy was, well, did you give feedback? Did they give feedback to the person who handed off the problem so that we could fix it? I'm not sure. Are we enabling that? Are we supporting that? Are we making sure that there are ways to do it? And are we appreciating it? Are we saying, this person is stepping out, this person is solving problems, we appreciate you, we are going to make sure that we show you that appreciation. All of these, I think, are important and necessary if we truly want to achieve our goal of being one VUMC team. We have to embrace the caring spirit that's already here. We have to nurture it. We have to make sure that all of the hard work we're putting into the work that we do doesn't just stay on the table for other people. We need to bring it back to ourselves. Thank you.
Thank you, Dr. Wilkins, for sharing stories of how we care for each other within our walls, and across our missions, beyond our walls, both broadly and specifically, and most importantly, how we care for each other.